Our seventh category today is improving patient experience. This award will recognise a team or service that can provide evidence of improving patient experience within any healthcare providers. And the finalists are NHS Manchester and their Primary Care Commissioning Dental team, Public Health and Development teams from CEC PCT, Cheshire East Council and Mid Cheshire Hospitals, the Diabetes Department from St Helens and Knowsley Teaching Hospitals NHS Trust and their project Diabetes Education Through Adult Learning. Let's have a look at these nominations.
The background to this project really was we had a problem in Manchester. Patients were unable to access routine dentistry, and when they had pain, very often they were having to queue around the Manchester Dental Hospital to access services there, and some of this was being highlighted in local media. So even those practices that we're accepting were finding it hard to communicate with patients. Many people were having to contact the PCT asking where and how they could get care, very often when they had a problem and needed care urgently that day. So we really had to do something about the problem. And this initiative brought together clinicians, patients and commissioners to say how could we really make timely access for patients and solve the problem. And what we've done is implement a local helpline so that people just need to lift the phone, call the helpline. If they've got a problem and are in pain, they receive a series of questions and would then be allocated to one of a number of slots. Over 30 practices take part in this across the city where they could receive care immediately. But if you were just wanting a routine visit to a dentist, then you could be directed through the same local helpline to find out where dentists are taking on NHS patients. It may be you want to go close to where you work or where you live. And many of the almost 100 practices in Manchester are now taking on NHS patients. Really, the impact we've noticed is that the number of calls into the PCT asking for help has dramatically dropped from really over hundreds in a week into single figures. So we know it's working, we know patients are using the service, and the dentists report that the protected time slots mean that we don't have disruption to the practice for people who need to be seen in pain on the same day.
We got involved in this project when the commissioning team of our local primary care trust approached us and asked us if we would put aside some time each day. Every morning and afternoon we allow some time with each dentist to see people who have toothache or are in pain. Some people don't know where to go, they don't have a dentist, so they phone up the direct helpline and they get, if they live near our area or work near here, they get given our details. They contact the practice early in the morning preferably, and we see them that day and do treatment to get them out of pain. And then they will come back if they need a further treatment, and we're happy to see them for as often as they want to come back and complete their treatment. We'll see them and take on that patient. We also have slots and separate slots that we use for patients who are currently at the practice. If they have toothache, they can just come to the practice, the desk, and make an appointment, or they could phone up, or if they come in and it's near the time of one of those slots and it's still free, we're happy to see them. We'll always try and help to get them out of pain, because you never know when you're going to get toothache, and it's usually before your holidays.
Next Step started in 2008 as a partnership project between Mid Cheshire Hospitals Trust, Crewe and Nantwich Borough Council, which is now Cheshire East Council, and Central and Eastern Cheshire PCT. What we really wanted to do was improve patient experience on discharge from hospital. We wanted patients to have information in the right format, in the right place, at the right time. The bags are packed by volunteers from the Hillary Centre, which is a centre for people with learning disabilities. The girls pack the bags each week for us, which is a huge help. The information that goes in the bag is a whole range of information based on the Choosing Health document, which is a government-led document. Information covers anything from health and well-being, from eating, physical activity, safety in the home. The key point is that all the information is tailored to people who are 60 plus. The scheme's followed up 6 weeks after a patient's discharged from hospital. They receive a questionnaire to tell us how they've used the information, and this information is used to further refine the scheme to make sure that information is always relevant. The big thing about the scheme is it only costs just £7 per person to run, and we anticipate over the last 18 months that we've saved the health service about £250,000. We've had some really positive stories come out of the Next Step scheme. People have changed their lifestyles in lots of different ways. We've got chaps in their 80s interested in healthy eating, ladies that have joined walking groups and Tai Chi, and other people who've had home adaptations done just by having the information at the right time, in the right place.
Managing long-term conditions such as diabetes is about supporting patients in their self-management of their condition. The days when the health service did everything for everybody, it's inappropriate, and people want to take charge of their own lives. And in order to do that, we have to support them, we have to help them, and a key element to that is education. DEAL is an education programme for people with diabetes. It's a suite of programmes because it's very easy to create a programme which serves the needs of a small proportion of the population, but where DEAL sort of wins out is the fact that it embraces the entire population with diabetes. What we did was we asked patients what they felt the strengths and weaknesses of the previous educational programmes were, and then we used their advice and their support and worked with them to build this new suite of programmes. Not only does DEAL improve people's self-management, they're able to better manage their diabetes, but also their anxiety levels fall, depression improves, all measures of quality of life improve, and satisfaction with the programme is extremely high. All measures were beyond the 90th percentile. It's making life better for people with diabetes as judged by people with diabetes.
About 4 years ago, I was rushed into hospital here at Wiston as an emergency, and a couple of hours later was diagnosed with type 1 diabetes. And when the doctors here diagnosed me, they said that the needles were one part, but the bigger part was about the education. So that's how I got on the programme called ICE, which is the education programme here, which is around insulin and carb education. I haven't done education for a long time. How was I going to cope with it? I was really, really scared. But when I came on the course, it was brilliant. Instantly, you were 8 other peers in the same boat. And the professionals from the unit who teach us it are really, really friendly. You didn't need to be an expert in maths. They made it simple but understandable. So the thing that I learned almost within the first 2 weeks of the programme was that some of the things that I hadn't eaten for a while, I could eat. I just needed to be able to work out the framework to the insulin, and that's what it taught me, which gave me fantastic freedom.
And the winner of the 2010 Improving Patient Experience Award is NHS Manchester and their Primary Care Commissioning Dental team. And once again, congratulations to all those involved.